Welcome to the first season of the Ecologies of Danger podcast. Ecologies of Danger is a project produced by the students of a course on environmental security at Colgate University. In this season of the podcast, we look at the different ways in which the environment has become a security issue. In this episode, SGillis takes us to Haiti, where a humanitarian crisis quickly turned into a public health crisis.
Tuesday, January 12th, 2010. It's a normal day in the Caribbean island nation of Haiti. People are going about their business, unaware of the disaster that is about to strike. At 4:53 p.m., the ground began to shake. Although the earthquake lasted for less than a minute, chaos quickly ensued. 12-year-old Getchine Dominic from a section of Port-au-Prince recounts her experience during the earthquake.
On the day of the earthquake, I was at home studying. When the earthquake occurred, I heard a sound. I tried to run out of the house, but I didn't have time to get out. The house collapsed while I was inside. When I woke up, I realized that I was buried under concrete. It was very dark, and I was crying for help.
This magnitude 7 earthquake was the largest experienced by this region in over 200 years. Its epicenter was located just 15 miles away from the highly populated capital city of Port-au-Prince. During the quake, homes were leveled, hospitals and schools destroyed. This disaster left 500,000 dead or injured and even more homeless. Unfortunately for these victims, the situation was about to get a whole lot worse. Haitians took refuge in humanitarian camps throughout the country, most of which were sponsored by non-governmental organizations or NGOs and other sources of foreign aid. These camps were often overcrowded and underfunded. Haitians were unaware that underneath all of the post-quake stress and death, there was another disaster brewing. Soon, reports began surfacing of cases of cholera. The dangerous diarrheal disease had not been seen in Haiti in more than a century, but somehow cases were popping up all over the country. Partners in Health, a nonprofit aid organization, recorded around 7,000 cases of cholera within 21 days of the initial outbreak. But the truth of the matter is, no one really knows the full extent of the cholera outbreak. So how did this happen? How did cholera get to Haiti after all those years? How did it spread so quickly? And most importantly, why wasn't it stopped? Even before the earthquake, Haiti suffered from the worst water security in the hemisphere. Only a quarter of the country had access to basic sewage. After the earthquake, displaced peoples moved to the already overpopulated capital and to refugee camps. This crowding put further stress on already poor sanitation systems. But the source of the cholera was international. The cholera outbreak can be traced back to a particular camp in which foreign peacekeepers from the UN were staying. The strain of cholera found in Haiti was the exact same strain that was simultaneously being battled in South Asia. The peacekeepers had recently been working in South Asia, and their untreated sewage went straight into the Artibonite River, a river used for drinking, bathing, and washing. Not only did the epidemic start because of a mistake made by the aid community, but also the humanitarian response in some ways made things even worse. Although the IDP camps were created to protect lives, they were also ideal spaces for disease to be easily passed between people. The tight quarters and lack of sewage and clean drinking water all perpetuated the outbreak of cholera. The problem only got worse once the NGOs backing these camps stopped providing free drinking water. One reporter described the dire situation in these camps.
At this camp in Port-au-Prince, water is delivered untreated. More than 10 camp residents here have since become sick. Families are given chlorine tablets to purify 2 buckets of water a day, but residents say that's not enough.
A mother in this camp speaks out about how these restrictions are affecting her family.
They give us 12 tablets and it doesn't last the week. My family consumes 6 buckets of water a day, so it's not enough for us.
Cholera is an example of how humanitarian aid can go horribly wrong. Right after the 2012 earthquake, there was a sharp increase in the number of NGOs present in Haiti. The immediate relief efforts by these foreign organizations helped people, but they did little to solve the underlying problems of Haiti's public health infrastructure. Their efforts became a band-aid solution, creating a temporary fix to the trauma without actually helping to provide long-term solutions. This temporary source of help created more foreign dependency and often left Haitians in worse conditions after the NGOs left. During the cholera epidemic, NGOs and international humanitarian organizations had a monopoly on aid. All basic resources, food, water, and shelter were controlled by these groups and distributed as they saw fit. In some ways, these actions privatized basic resources throughout Haiti that should have been public and controlled by the government. This undermined the Haitian government and created a new corrupt, unchecked governing force. Kevin Edmonds, a political scientist from the University of Toronto, explains that foreign aid has become a business with a primary goal of satisfying its donors rather than the people it was created to help. While not all NGOs are corrupt, some of the big players are rolling in aid money while the people of Haiti are suffering. The top 10 international NGOs made $8 billion in income in 2010. NGOs would not exist if there wasn't a demand for them, so they create a system in which the people they are supposed to be helping become dependent on them. The end goal of these organizations should be to wean people off of their support and help them become self-sufficient. But what kind of business model is that? Although scientists trace the start of the cholera outbreak back to a UN camp, the UN would still not admit any fault in the matter. For years, they insisted that they had no involvement in the cholera epidemic, nor would they appear in court where they were being sued for $40 billion. This continued denial spurred outrage among Haitians, leading many to protests. These protesters are angry because the UN won't admit their role in the outbreak. They are angry because the NGOs are not helping them. They are angry because the government is still dumping untreated waste in close proximity to their homes. Pierre Gerelson, a protest leader, describes some of their frustrations.
In addition to the cholera disease, which is destroying the country, we, the population living on the plain, are all standing up to say down with the feces that they are dropping in the national dump.
In 2016, nearly 6 years after the first case of cholera, the UN admits to having some role in the terrible outbreak. While this admission is a step in the right direction, the UN still refuses to take any legal responsibility for this atrocity. Nor are they willing to pay reparations. When asked if he thinks the UN has learned from their mistake, Brian Concannon, the executive director of the Institute for Justice and Democracy in Haiti, cited an international investigation report issued by the UN.
It concluded that the UN, even in Haiti, was continuing to release untreated sewage directly into Haiti's environment as recently as last year. So I think it's certain to say that the UN has really learned the lessons.
Although the UN finally admitted to some responsibility for the cholera outbreak, they are not taking enough steps to help make up for it. They are also not changing their practices to make sure this problem doesn't keep happening. So in the end, while still doing an incredible amount of good, the NGOs were the source of the cholera epidemic. They created the camps in which the epidemic was able to spread so efficiently. They didn't properly distribute resources. They privatized aid and undermined the Haitian government. They created dependency on their organizations. While they were put in place to help the people of Haiti, many of their actions seem to have perpetuated the cholera epidemic and made it impossible for Haiti to recover. As long as Haiti is dependent on these NGOs, there is no hope of creating a self-sufficient nation. This is SGillis at Colgate University.